So we're going to dive into the TMJ, which is your temporal mandibular joint, which is essentially just what we call the muscles of mastication. It's when you open your mouth and close. Right, there's a roll and glide of this joint, and it has to occur. And if it doesn't occur, then we can have pain. We can have a jaw that opens up and kind of deviates towards one side, and we'll talk about why that's occurring. And I have a lacrosse ball here because there's a lot of muscles we can where we can hit that I think can really help open, right? If you have a TMJ issue, that can really help loosen things up and just get things moving the way they should. Now, before we dive in, we have to understand, what's going on if we have issues where there's a click or there's pain at our TMJ joint. So first thing is, if you're having pain here, we have to understand that this joint, when I am opening and closing my mouth, there's actually two movements that are going to occur, and one comes after the other. So the first one is just a roll. It's a roll and glide. So the joint actually just stays in place, and there's a roll. If it just rolls, it'll actually translate forwards, but there's a roll and glide. It stays in the joint. So when I first open my mouth to right around here, it's just a roll. Once I go past that, when I get, there's like the opening part, and what happens once I get to, or around here, there's much more of a translation forwards, and that allows me to open my mouth even more. So what's happening here is the joint, it's rolling, it is rolling and gliding in place, which is just how joints move. Most joints in our body move this way, and eventually, at last little bit, my jaw will actually translate forwards, and it allows more of that roll to occur. So it excessively translates forwards, and that spot tends to be where there's lots of pain. There can be clicking, there can be catching, and sometimes it's like your jaw stuck, which we definitely have to do some joint work on that. But there's a disc in there as well, and that disc can get caught. That typically causes the click and can cause pain. So essentially what we can do is we can mobilize this joint, and we can also release some of those muscles in that area. And actually, I'm a big fan of actually strengthening the jaw, which we'll talk about at the end. So first thing I love to do is get a lacrosse ball. I'm not going to show you guys laying down, but you should be laying down, relaxed. For the sake of this video, I'm just going to have it here because just easier to make it like this. So what I like to do is I'll actually first hit my temporalis muscle. So it's actually it's a muscle that starts on the side of your head, on your temporalis bone, comes down and helps you bring your teeth together. So what I do is I'll have my finger here and I'll bite down. I'll clench my teeth a little bit. Hopefully you guys can see. I don't know if you can see this muscle contracting. I'll find it, and then what I like to do is hit it with a lacrosse ball. Just roll around that entire area. You can do an active release by doing it like this. Do that for around 2 minutes. Very strange muscle to get. This actually can cause headaches. So if you're like, oh, this sucks, this is just a great muscle to hit. So that's the temporalis, right? You can do that for around 2 minutes. And then we have the masseter, which is another easy muscle to hit. It's probably the easiest one. So it's right on the angle of your jaw here. It's right, just kind of right, we're kind of right above it, and then towards your, towards the opening of your mouth. And I just you can poke in here. Try to find it. Once you do, you can massage it. You can actually keep your fingers here. Again, 2 minutes. You can take a lacrosse ball as well, do the same exact thing. You go for 2 minutes. You can sometimes be careful. If you do one side, you'll push the jaw this way. So I like to counterbalance that and have equal force here, so you're not giving that like weird lateral sideways force on it. So I'd be careful with that. So we hit the temporalis, we hit the masseter, and then you can actually hit one of the pterygoids. I believe it's the lateral pterygoid. So what I like to do, try to find, there's this part of it's called the zygomatic arch. It's just a part of your facial bone here. It's called the zygomatic bone. If we can dig in here, it's like right where find that masseter. I like to find the angle here, and I'll just go, we're straight up. Okay, you can actually follow that masseter muscle. Clench it, feel it. And whenever you hit a bone, that is the arch. That's called the zygomatic arch. Right here, dig in. You want to get underneath that arch. It's hard to get in there, but This is it's one of the, I believe it's the lateral pterygoid. And if you can get in here, it's a great muscle to release. You can just put pressure and hold it. The mine's a little bit sore. This muscle sucks. This is actually giving me a headache, which is a sign you got to release this thing. So if it's like, if it's like giving you a headache here, I promise you the headache's gonna go away. It's just, this is when this muscle refers pain into the head. It's kind of where sometimes it refers there, but also that's where the nerve that innervates it goes. You can also go like this. Oh, that sucked. You can do both at the same time. Again, I'm gonna push on that TMJ joint. My left side sucks. Okay, that really sucked. It might feel that way, and if you have an issue here, it's gonna feel that way. Hopefully, it should help things. Your mind's, I'm still coming out of it. My slightly headache is going away. That's very intense. And the last one I'm gonna give you guys, man, there is a way to get to the medial pterygoid. It's just a little bit advanced for this. You have to like follow on the outside of your teeth on the top here, dig your finger in, and you find a soft tissue spot. It's a really weird area to hit. I'm not gonna show you guys. I would just YouTube how to hit the how to release your medial pterygoid. Give it a shot. What we're gonna do is a self joint release. And when I open my mouth, if I'm like this, and we're noticing this happens, right? You're deviating one way. Whichever way you are deviating to, that is the tight side. So if I'm deviating to my left, right? If I'm here and I'm going this way, that means my right side's moving more, and when it moves more, like it's gonna go like this. It's gonna deviate, because this is moving more, it's gonna whoop. If I'm going to the right, I'm gonna go this way. Bam, I'm deviating to that right side. So what I'll do is, and you can self-do this. If I do this with patients, I mean, obviously I have a glove on. If it's yourself, you just wash your hands. You probably don't have to do that. But you go just like this, take your thumb, you're gonna place it on your molars, and you don't wanna just like, right? You should have a little bit of kind of just natural resting tension here. And you'll maybe depress your jaw a little bit, but you're trying to traction that TMJ joint. So it looks like this. All right, I'm not here. All right, we don't want that. Just resting tension. Straight down. I like to hold 3 to 5 seconds down and then relax. You do one side, do the other side. You go for like 10, 20, even 30 repetitions, right? Your jaw's probably gonna, right? Your teeth are gonna give you some indentations on your fingers. In that case, if you wanna wear gloves, go for it. But I hope this is gonna help you guys. And just realize too, again, if I'm deviating to the left, this is the side I probably wanna mobilize. If I'm deviating to the right, this is the side you probably wanna mobilize. I'm sure there are manipulations. I mean, I'm not gonna show you that here. I don't even know what they are. I mean, this is a pretty delicate joint. I don't think I'd ever manipulate it even if I knew how to. But it has a joint capsule, right? There's a disc that helps this joint move the way it's supposed to because we just use it so much. There's that disc, it's like it's like we have a meniscus in our knee, a labrum in our shoulder with discs in our back, right? It has a purpose, but that disc can sometimes get out of place from tightness and weakness. So highly recommend you guys try these releases and we call it a mandible traction. You can actually do this too. You can actually depress it, and you can actually, it's hard to do it on yourself, but you can actually pull this way. That'll help with some mobilizations. That'll help with the mobilization as well. So I hope this helped. Try it at home.